There are different causes of the most common changes in physical or intellectual development or genetic conditions. Before learning about the testing options available, the next few slides will review how some of these conditions occur and what it means for an individual or family to be affected by them. Some conditions, such as Down syndrome, occur as the result of an individual having an extra or missing chromosome. Chromosomes are the pieces of genetic material that carry our genetic instructions. Most people have 46 chromosomes total. They can be organized into pairs. You typically receive one chromosome in each set from your mother and one from your father. The sex chromosomes determine fetal sex. Most males have one X and one Y chromosome. Most females have two X chromosomes. When our bodies are producing egg and sperm cells, the sets of chromosomes are divided so that each egg cell and each sperm cell will typically have just one copy of each set of chromosomes. Sometimes the chromosomes may not be divided evenly, and a sperm or egg cell may contain an extra or missing chromosome. If one parent passes on both chromosomes, and the other passes on his or her chromosome, a pregnancy can begin with an embryo having an extra chromosome, 3 total. 3 copies of a chromosome are called a trisomie. If one parent does not pass on a copy of a chromosome and a pregnancy begins with just one copy from one parent, this is called a monosomie. Any pregnancy can begin with a baby having an extra or missing copy of any of the chromosomes, generally called aneuploidy. Most of the time, many instructions on the chromosome being extra or missing would cause a natural loss of pregnancy very early, often before a woman even recognizes she's pregnant, or soon afterward, usually in the first trimester. However, there are a few conditions, like this, where a pregnancy may continue to the second or third trimester, or with which a baby may be born, such as an extra copy of chromosome 13, 18, 21, X, or Y. Down syndrome is one of the most common chromosome conditions. It's caused by an individual having an extra copy of chromosome 21, called trisomy 21. The extra copy of chromosome 21 may affect the physical development of the heart or bowel, which may require surgery after the baby is born. It may also cause additional breathing, vision, hearing, or thyroid problems beyond what is typically expected in childhood. With proper medical care, most individuals with Down syndrome can live long, healthy lives. While most individuals with Down syndrome have mild to moderate intellectual disability, they often attend school, work, and can be active participants in the community. Extra copies of chromosome 13 and 18 can be more severe in comparison in both physical and intellectual development. Both conditions have a significantly increased chance for natural loss of pregnancy in the second or third trimester, or of stillbirth. Babies born with trisomy 13 or 18 may live a short time. Less than 10% survive a year or more. The sex chromosomes may also be extra or missing. Many individuals who have an extra or missing X or Y chromosome may not know they have it, and may not be expected to have significant changes in development as a result. Exceptions to this include females who have one X chromosome instead of 2, which is called monosomy X or Turner syndrome. There's a higher chance of natural pregnancy loss when this condition is identified. Otherwise, females born with Turner syndrome may have some heart or kidney problems, usually have infertility, and often have areas of learning difficulty. Males who have 2 X chromosomes instead of 1 and 1 Y chromosome are said to have Klinefelter syndrome. They're not expected to have significant physical medical issues, but may also have learning difficulties, behavioral problems, and infertility. Females can also have an extra X called trisomy X, or males may have an extra Y chromosome. Screening for extra or missing sex chromosomes is available in pregnancy. A possible benefit of knowing about a child having a sex chromosome condition is that additional screening or early intervention therapies for developmental delay or speech delay may be provided sooner. Anybody at any age may have a child with an extra or missing chromosome. However, the chance for this to occur increases slightly with age. This table demonstrates the change with age. Column 1 lists a mother's age at delivery. Column 2 is her chance to have a baby born with Down syndrome. Column 3 is her chance to have a baby born with any chromosome condition. The last column demonstrates the chance as a percent. For example, a woman who is aged 35 years at delivery has a 1 in 365 chance to have a baby born with Down syndrome, or a 1 in 178 chance to have a baby born with any chromosome condition. Overall, this is about 1/2 of 1% chance that her child would have a trisomy or monosomy chromosome condition. This means she has a 99% chance her pregnancy will not be affected by any of these. Genetic conditions may also occur as a result of many factors. Multifactorial genetic conditions are the result of a combination of changes in genetic instructions and environmental factors. Examples of multifactorial conditions include heart disease, type 2 diabetes, depression, and anxiety that often occur later in life. Some of these most common physical changes in development are also multifactorial, including congenital heart anomalies, cleft lip or palate, and spina bifida. Spina bifida occurs as a result of a disruption in the development of a baby's spine very early in pregnancy and has a wide range of severity. Some babies are unable to survive without complete development of the skull. An individual with moderate spina bifida may have increased fluid in the brain that may require surgical placement of a tube to drain it. His lower body may be paralyzed and may require assistance with bowel and bladder control. Some individuals are not identified at birth, do not have significant physical problems, and be diagnosed later in life with lesser symptoms or just by accident. If you are interested in getting more information about some of the conditions discussed in this presentation, you may visit any of the web links listed here for organizations that provide additional information about specific conditions, as well as support for families with a new diagnosis of these conditions.